Okay, thank you for taking part in the interview for the Nuclear Medicine and Molecular Medicine podcast. We're here in Denver in Colorado at the Society of Nuclear Medicine meeting, and perhaps you could just tell me a bit about yourself and where you work.
Okay, do I need to say hello?
You can say hello, yes.
Hi, everyone. My name is Wong, and I graduated from Johns Hopkins University with a PhD, and now I'm working with United Imaging Healthcare.
Right, excellent. Now, United Imaging Healthcare is something that most people in the nuclear medicine community aren't familiar with. It's based in Shanghai, and what machines do they make? What do they make?
They make all kinds of modalities like PET-CT, CT only, and DR, MR, PET, and they're also developing PET-MR.
Right. So I think what's particularly interesting is that they've got PET-CT and PET-MR that use digital detectors.
Yes.
So they've got LSO crystals and digital photomultiplier tubes, correct?
Yes. Yes.
Right. So that's very exciting. So part of that is that is the high sensitivity of these cameras.
Yes.
So you can do get a lot more counts than you otherwise could, and also better timing. So how much better are they than conventional PET-CTs?
I think, as you mentioned, it's high sensitivity and also we have a larger axial field of view, which is 30 centimeters. It can cover the body. Like you use fewer number of beds for a whole body scan, and also we have very high resolution, so you can see all the lesions more clearly.
Right, and the sensitivity of the cameras, I saw you, that was about 16?
16
kilobecquerels per 1,000 counts per megabecquerel, yes. And a conventional camera's something like about 4 or 5,
yes,
isn't it?
under 10, definitely under 10.
And the timing, the time of flight timing that you've got on the machines, what's the timing? How many nanoseconds?
About 400 to 500.
Yeah,
I don't
400
remember
500. So
number, but
that's fairly good. I mean, you've conventional ones are sort of about 5 or 6.
Yes.
So it's a little bit better.
Yeah.
Yes.
And I think we can probably trying to improve it because currently other companies are catching up. So.
Right. I think the GE and the Philips systems are about 250 to 300 nanoseconds timing. So not quite as good, but I imagine your machines would probably be less expensive than those machines, were they?
Yes, probably, and also, the one point is our spatial resolution is much higher than their scanner. So it's like when you go for one property of the scanner, you probably have to sacrifice a little bit other parts. So the major property of our scanner is a high spatial resolution and sensitivity. That's what we aim at. Right.
So the spatial resolution of your systems, what do you get? Is that because you've got a very small voxels, correct?
Yes.
So what resolution are you getting in the clinical
2.9 millimeter.
2.9 millimeters. That's extraordinary.
Yes, we have very good brain images because of the very high system resolution.
Right, and okay, so that's very impressive. That's a very high level of resolution and very good sensitivity. So that's going to make things like things where movement's an issue, or where people have to stay still for a long time. Yes. You'll be able to get the scans done quite quickly. It's like in oncology, it's hard for people to keep their body still, or if you're doing imaging where you want to minimise the radiation dose, where you're doing multiple studies, then you can do it, give lower dose, or if you need to do scans faster, where you're looking at flow studies in the brain, for example, and things like that. That's excellent. You showed a talk where you looked at optimizing their resolution, and how long were how long per bed position were you looking at?
Currently in the hospital, they use 2 minutes per bed position.
Wow.
But we are working on to shorten it.
Yeah, well, I was looking at your contrast on the lesions, and you were getting excellent contrast with just 1 minute. for bed position.
Yes, I think 1 minute the image quality is really good for diagnosis.
Yeah.
So probably we can go lower.
Okay, that's very interesting and very exciting. What else would you like to say about what you're doing? You've got a pen MR in work. That's with a 3 Tesla MR incorporated with the PET?
Yes, I'm not in that project yet, but I heard they are already starting to probably do some clinical trials, and I have seen some image qualities, and it's really good.
Oh, excellent.
Yeah. And also, except for the PET MR, we are also working on developing some advanced applications for the PET-CT scanner. For example, we are trying to correct for the motion, to do the data-driven gating, to try to simplify all the procedure and make things easier for technicians.
Right. Yes, I saw a paper earlier on where they did data-driven gating.
Yes.
And it actually positioned a region of interest or a region in the centre of the heart, and then looked at count changes as the heart beats. And as long as you position it in the centre of the heart, you're going to get an increase on systole of counts and a decrease on diastole. As long as that position's in the middle, and then you could use that simply to do the gating without having to apply an ECG.
Yes, that will make things easier for technicians, because the technicians have to set everything up when they work near the patient. And if we have the data-driven gating, we don't need the technician to put on any equipment on the patient. So the dose will be reduced for the technicians.
Right, and it also just means there's less complexity in terms of setting up. So, so you're going to incorporate this in your clinical software?
Yes, definitely. We have applied for patent, and we are working on implementing it into the machine.
Excellent, excellent. Well, this is very exciting. It's very new, and how many machines have you got out there now? How many machines PET machines do you know?
I don't know the exact number, but I think it's a lot.
Really? Yeah. So it's very exciting, and it's great to see some new players and some good competition in this area. And it's very exciting to see.
We look forward to coming to US, and actually we have entered Europe and Japan, so we're looking forward to maybe compete with the big companies.
Right. Well, you've been part of the Explorer product. I mean, Dr. Cherry, I've interviewed before on the podcast, and basically the Explorer products, where you're going to have a whole body PET scanner.
Yes.
And you're doing that by having an extended field of view of your camera that covers the whole body, and of course that's going to be very good for dynamic studies and first in man studies, where you want to do accurate radiation dosing and actual quantification. So that's quite exciting that the United scanner is part of that that project. So that'll be great to look forward to. Is that that you had a mini version of that scanner already working, isn't it?
Oh, yes. I think they started doing some monkey studies.
Right. So that's also very exciting. Yeah, so is that going to be available for clinical use?
Oh, yes, definitely. I think you can use it to image the brain. Actually, the image quality will be very good, because the field of view and the sensitivity and the resolution will be very high.
Oh, excellent.
And they probably will do some brain studies.
Good. Well, thank you for taking part of the podcast. I appreciate your time, and good luck with the future.
Thank you very much.